Here is my influenza public service announcement by Jacob Fisher. The name of the pathogen is influenza virus. Influenza is a virus, as just mentioned. Specifically, it is an RNA virus in the Orthomyxoviridae family. There are 4 types of it: A, B, C, and D. A and B cause seasonal epidemics. The mode of transmission can be through respiratory droplets produced when an infected person sneezes, coughs, or talks, and also through touching a contaminated surface with the virus, then touching one's mouth, nose, or eyes. For the mortality and morbidity rates of influenza, globally, there are around 1 billion people infected with influenza each year. 3 to 5 million of these are severe cases, with around 290,000 to 650,000 deaths each year. The U.S. alone has 9.3 million to 41 million cases each year, with around 12,000 to 52,000 deaths each year. For its origin in infected regions, the origin of influenza is unknown, but may be through animals. Influenza-type viruses have been around for centuries with occasional pandemics. Famously, the Spanish flu was a particularly deadly form of influenza, causing around 25 to 50 million deaths. Influenza affects people globally, with a worse effect in nations with poor health care. Flu season peaks between December and February. For signs and symptoms of influenza, signs can include fever, cough, runny or stuffy nose, sweating and chills, and vomiting. Symptoms can include headaches, body and muscle aches, fatigue, nausea, sore throat, and dizziness. For diagnosis of influenza, doctors will first do a physical exam and see if you have the symptoms of influenza. Diagnosis can be confirmed further through tests, such as RDT tests. RDT tests give very quick results, but can be less accurate. They detect influenza antigens. However, RT-PCR tests are molecular tests which take longer, but have better accuracy. They can detect types and subtypes of influenza. They detect genetic material. For treatment and care of influenza, a common treatment that can reduce the duration and severity of influenza is antiviral medications. Some of these include Tamiflu, Relenza, Rapivad, and Xofluza. Generally, things such as drinking fluids and rest will help in reducing symptoms. In severe cases, hospitalization can be necessary. However, in less severe cases, in people such as young, children, and elderly, hospitalization may also be necessary. Infected individuals should stay home until feeling better, and it is also recommended to stay home until 24 hours of not having fever. For prevention of influenza, annual vaccination is the most effective way to prevent influenza infection and, if diagnosed, also reduces risk of serious complication. The first vaccination for influenza was developed in the 1940s. Other preventative measures include frequent hand washing, avoiding close contact with infected people, disinfecting surfaces, and staying home if feeling sick. For prognosis, healthy individuals will likely recover in around a week or 2. High-risk individuals, such as young children, elderly, and those with chronic health conditions, could have more severe complications such as pneumonia, bronchitis, sinus infections, and even death, and may recover in longer than a week or 2. Here are my sources, some more sources, and thank you.